Hi, everyone. Welcome. Thank you for joining us this evening. This is the Sofwave Synchronous Ultrasound Parallel Beam Technology webinar. I'm Carolyn Grimes, Marketing Manager for Sofwave, along with Kim Bella, who most of you have already met. And I want you to know that at the end of tonight's webinar, we'll have a live Q&A. So if you have questions, we encourage you to get involved and ask whatever's on your mind. We want this to be a lively banter and a lot of fun. We've enabled the Ask a Question feature, and you can find that at the bottom of your screen where it says More. So just write your questions in there. And the star of the webinar, who'll be answering those questions, is Dr. Sean Paul, who's the founder of Austin Face and Body. He's a board-certified oculofacial plastic surgeon in Austin, and he's well known for his blended approach of the non-surgical treatments, and he does a lot of surgery as well. So Dr. Paul, he trains doctors all across the country on the most advanced, minimally invasive techniques. He's been featured on all the TV networks about his work. Dr. Paul.
Hello, everyone. Dr. Sean Paul here. How are you? Well, welcome this evening. We're going to go through some slides on Sofwave and our practice's experience with Sofwave. Thank you for the amazing introduction, Carolyn. That was very nice. And I'll speak to you as a surgeon, as someone who owns a practice, and also as a user of Sofwave and our experience. So just to be clear about what the clearance is on Sofwave to date, it is lifting of the eyebrow, lifting of black submental tissue, lifting of neck tissue, and reduction on fine lines and wrinkles. So I'm going to talk a little bit about the technology itself, which is really interesting, unique. I think it sets it apart from the other technologies in that it's 7 parallel ultrasound beams. There's high intensity, high frequency energy that coagulates tissue in the mid-dermis. And what I like about this from a surgical standpoint is that it's very controlled and safe and prevents tissue injury. Now, what we do recognize that from a important standpoint is the safety, and we do see the real-time measurements when you're actually using the device. There is a proprietary feedback controlled skin cooling system as well, which makes the procedure comfortable for patients. And what's really nice about it in our population, which is really diverse in Texas, is it treats all skin types. Another thing I love about this treatment, it's completely non-invasive. And so what it does differently, again, is it kind of geometrically from a 3D standpoint, shapes the thermal injury zones, or basically the treatment zones is what I call them, and then treats them parallel to the skin as opposed to other technologies which go perpendicular to the skin. This really is important when we talk about damage to underlying structures such as nerves, bone, blood vessel, and facial flat. And what's really cool is it treats along the vector lines, which are particularly important for facial wrinkles and lines, and that add for skin lifting. Now here's a biopsy of skin before and after treatment. And what's important here to know from a histopathological or histological standpoint is the collagen and elastin are improved in the standpoint from the structure. Basically, there is the injury that's delivered to the tissue, and then it reforms and tightens. And you really see it before and after quite significantly. And we typically tell patients it can take even up to 3 weeks to see results. Really, as it goes from 3 to 6 to 9 to 10 months, we're seeing much more improvement as well. And obviously each patient is different. And so you're going to have some patients who come in with very beat up or very aged collagen and elastin, and that's going to improve even more. But some of those patients we do a second treatment sooner than that. Here's an example of the parallel ultrasound kind of in working away here. And what you can see here is really a softening of the fine lines and wrinkles and a lifting of the tissue, which is quite significant. Even for someone like myself, who's an eyelid specialist or an oculoplastic surgeon that has a practice that does a lot of blepharoplasty surgery, there are patients who just have fine areas that need that extra bit of lift, and this does a great job at doing that. This is a comparison between the HIFU, as I mentioned before. HIFU gained a lot of popularity quite a few years back, but some of the issues we saw with that treatment were, different transducers, treating at various depths, and then it really was kind of heating at the deeper structures. And then what we like about the newer technology, deeper layers, and we like about the superb technology or the parallel technology is that it really controls it right around that 1.5 millimeter of depth, and it covers a lot of area. So areas we like to use the Sofwave technologies in the upper part of the face, the mid face, and the lower face and the neck. There are some off-label treatments as well that we'll show you some pictures of later, but the coverage is quite impressive because of the way the technology is delivered. So patients with aging skin, laxity, wrinkles, skin irregularities, scarring, all can be treated. There are really no limitations. Age that's recommended is over 22, but can be any sex, weight, skin type. I agree with the FDA stand of it, part of it, which is it's best for younger patients, but there certainly are patients we've treated who are outside that range who really see an improvement, and even have told me when they come back that they feel that their skin is tighter, which is really nice to hear. And there's a lot of patients who do not want a surgical facelift. So it does work well in older patients to provide a tightening appearance. Now, a question I get a lot about is combination treatment. And fillers are not contraindicated with this treatment, but we do recommend kind of a window separating the two treatments. And once again, the FDA clearance is for improvement in fine lines and wrinkles. And during the study that was performed by Dr. Geronimous and Dr. Kovar, there were 60 patients. They had a single treatment, and they did 3-month follow-up, which is very normal for FDA trials. And 86% of those patients had a reduction of the wrinkle elastosis score from the Fitzpatrick scale, and also 78% had a reduction after a blinded evaluation. The treatment was well tolerated. It was really safe for all skin types, and there was a good safety profile. And here's an example of a patient from that study. And what you can see there is, I think my arrow will pop up here, is really just an improvement in the overall firmness of the skin, appearance of the skin, the laxity of the skin. So for patients who don't want a full invasive deep plane or SMAS plication facelift, or a mini facelift per se, it's a nice option. Here's another photo as well in the submental area. And this patient has platysmal band laxity, some jowling, and what you're seeing is an improvement of the contour. Now, obviously, if this patient wanted surgery, it would be very reasonable and probably your first line treatment, but a lot of patients just don't want that, and they want an option to improve that texture and tone in that area. So here was the publication. It was published, and it was really important to note that that there is a very safe profile here, which is critically important because of the other ultrasound technologies of old that would cause injury and potential problems. And now we're having something very safe that can improve the appearance of wrinkles on the face and the neck. And this was the pivotal study. There was another pivotal study here that followed that as well, that really showed the importance of how it could lift the brow, lift the submental tissue that was lax, as well as neck tissue. And in this study, there were 80 patients. There were double treatment study, and there was a 3-month follow-up. And on the brow portion, and if you have experience doing surgery on the brows, we all know how challenging that can be when you're talking about hiding scars, when you're performing that appearance, whether it's in the hair line or around the brow or through the eyelid. And 80% of these patients were noted to have some sort of eyebrow lift, which is really, really impressive. And on the submental, or the lax submental tissue in the neck, 84.5% of patients were known to have improvement. So this is quite significant, because even in surgery, sometimes you aren't seeing that kind of percentage of results. I don't think this treatment replaces surgery, but it definitely offers a nice option as an alternative. So on the top picture there, you can see the patient's brow and subsequent dependent dermatochalasis or heavy skin below. And then in a patient looking the same way, same angle, everything's really consistent in this photo. You're seeing the brow tissue lift up, and subsequently the skin as well. So although it's not an indication for heavy skin lifting, the brows lifting, which is usually one of the primary causes for heavy skin on the eyelids, it's lifting everything. And as more and more patients are going toward conservative treatments, non-aggressive surgery, this fits right in line with all of that. Same thing here as well. You're really seeing a patient have improved results as well. And I think what I liked in this picture, particularly in the lower face here, you're just seeing just an improvement in the tightening of the skin. And then around the brow, you're having the subtle lifting appearance as well. Again, here on the submental tissue as well, it's just really impressive to see at 12 weeks after 2 treatments, you're having quite a bit of improvement in the submental tissue and the appearance of a tightened jawline, which is really impressive to see after 2 treatments. Another picture here. I like how the markings are drawn out with the measurements. And I really think the submental tissue here in the mid face here, you can see it's looking really lax in the picture before, and afterwards you're having some tightening and less laxity in the tissue. This patient here, I think her quality of her skin looks amazing and improved. You're seeing improvement in the different folds and lines around the middle of the face, as well as the bands underneath the neck. And I think these are all softened by the lifting effect of the technology. Next picture here, these patients typically, it'd come into a plastic surgeon's office and we would consider doing surgical lifting of everything. Some of these patients really don't want or desire the scalpel. They don't want the downtime from surgery. And so when they have kind of a treatment that they can walk in and do in an office or a medical spa or a facility and walk out that office the same day and go about their normal routine and have some improvement in the brow architecture, the arching of the brows, the improvement of the brows, as well as the face, and an overall tightening feeling. I think that's why we like the technology at our practice. And so the study design was really a prospective self-controlled clinical study to assess a new generation ultrasound device to lift the lax skin on the brow, submentum, and facial rhytids. And the investigator assessed the improvement of each area, and the subjects were reporting here the satisfaction and willingness to perform additional treatments. And we documented the researchers documented the comfort of the treatment and also response and the safety aspects throughout the entire treatment. So the results, all the studies, all the subjected patients were treated in the areas and involved in at least one follow-up visit. And improvement rates were already high at 3 months, but then 80% of the subjects that were improved even more on the temples or the brow, or they, and 100%, well, 80% of the subjects improved on the forehead and temples, 80% improved on the cheeks, the chin and perioral areas, and all subjects treated on the neck and submentum really showed in this area an improved laxity in the tissue. And so 6 months after these treatments, it's an important thing to note when you talk about retreatment, how often you retreat patients. If 93% of the patients were still happy with their brows, 93% were still happy with their cheeks and chin, and 92% were still happy with the submental and neck. And so as a clinician and a practice owner, we think about retreatments and timing that out and pricing and things like that. It's great to see such a high satisfaction rate when it came to follow-up. And the second part of the results here was consistent with our assessments that there were high satisfaction from the results. So 87% noticed improvement, significant improvement on the forehead, temples for the eyebrow, 93 to 92% reported improvement on the cheek, chins, perioral, submental, and neck areas at one of the visits. But the important thing to note here was that most of the subjects, they wanted to have future treatments. Important next thing to talk about was the pain. And so with all of our cosmetic treatments, whether it's injectables, laser technology, radio frequency technology, when looking at when choosing another device for your practice, you want to think about pain because it really affects your satisfaction and repeat user rate for the treatment, repeat using of the treatment. And then also you take that into account when you talk about the operational flow through your practice. Does the patient need topical numbing? Do they need oral medication to help them feel more comfortable? Or can they just walk in and get it done and walk right out? And so patients have reported a subjective pain level on a scale of 0 to 10 of 5.6, and there was a range there of 1.8. And I always tell this to patients too, if you're feeling something, you know something's happening, but if you feel nothing, nothing's really happening. So I think it's great to know that the immediate response after the treatment as well just showed some slight reddening or erythema, slight edema, and that was seen observed in about 67% of the treatments. And there was one patient there that noticed some facial peeling within 3 days after the treatment. So overall, very, very minimal chance you're going to have any noticeable sign of treatment done. And here are some clinical photographs as well from the treatment. And these were from Tennessee. So Dr. Gold's team that had done this study, but very impressive on the laxity of the tissue along the jawline and the quality of the skin and appearance. And this is a 6-month follow-up. Same thing here. You know, I think quality of the skin, obviously, this is a Fitzpatrick, 6 patient, well, 5 to 6 patient, and you're having quite a bit of improvement in submental laxity here. And I think that's really important to know. These patients have few options that they can be treated for. So particularly in Texas as well, we have patients who are Hispanic, Middle Eastern, of Asian descent. And it's nice to have this option for them. Another patient here, more like a Fitzpatrick 3 to 4, with a little bit of a tan, and improvement in the laxity of the neck tissue, which is really nice to see. And the versatility here is quite impressive with this technology. This patient had 2 treatments with a 3-month follow-up, and then had 2 treatments at a 6-month follow-up. And so what's very intriguing about this procedure is repeatability and the ability of the treatment provider to safely repeat treatments if needed. And I think that patients are really liking the fact that they have an alternative to alternative treatment that doesn't necessarily give them the downtime that other treatments have. And that's where we also use it quite a bit in our practice. So just kind of in conclusion, it's really nice to have a new generation ultrasound device that safely provides clinical lifting of lax or loose skin in the brow and submentum, as well as facial wrinkles. That's all we have from the specifics there, but I will go through some more case studies here. But that's the conclusion of these studies. So here's some more pictures here of results we've had from different users across the globe. This is a 2-week follow-up on the submentum, 6-week follow-up on the submentum, another 2-week follow-up in loose tissue around the jawline and the submentum. Another great result here. You see an improved contour underneath the chin. The skin seems to be really hugging everything around the natural jawline, which gives a tightened appearance. A very impressive result here of neck skin laxity and loose tissue in the submentum, and how at 1 month that patient really has kind of filled out all the hollowing and laxity in that tissue and has a really natural appearance. Same thing here at another 2-month follow-up with lax tissue. It's a tough case, really aged skin and an improved appearance in laxity. You can see the pictures are standardized here, which makes it really nice. You can see some consistency in the photos and how the appearance of tightening or laxity is sort of gone, and there's just really improved texture of the skin. This patient here with her brows, you can see that the heavy skin has started to lift away. The brows are improving the appearance. And just in the submentum here, the lax tissue. And, there's so many different treatment options in this area, whether it's injectables or laser or radio frequency. And I think ultrasound provides a really nice option for patients who don't have downtime or don't have the ability to, or patients that don't want to show that they had anything done. That's what's really great, that this treatment really improves the laxity of that tissue. This is a tough case as well. Typically, this would be something surgically you could address. And now we're having patients who are opting not to do surgery and want to do something to improve the tautness of the skin. And I think this is a great option here. This is an off-label treatment, but other areas that have been explored by the users across the US and across the globe are areas of laxity on the body. And you can see here the results around the arm, on the tummy, also around the skin, around the belly button there. And here's a video just kind of demonstrating the treatment. So I just want to show you the ease of, we delegate this treatment to our mid-levels and estheticians in our practice, and you can just see how easy it is to use the technology.
Yeah.
So you always want to put the ultrasound cooling gel on the skin and work in a uniform pattern, and the parallel ultrasound really spreads the treatment nicely uniformly throughout all the lax skin. And you do feel a little spice, and you can control that a bit, but you do want to treat to a therapeutic level to see some improvement. So we usually do topical numbing for about 45 minutes ahead of the treatment time, and the patients do fantastic. And we divide our treatments up into 3 options for our patients: on the face, upper face, from the lower eye down to the jawline, and then everything from the neck down the décolleté area. And that really provides patients some options on how extensive of a treatment they want to do. Or if they want a niche area, particularly after surgery, after eye lift, after neck lift, after facelift, this is a great option for follow-up treatment as well. So why should you choose Sofwave? Well, just the way I chose it was we really needed something that was had a good learning curve, that was not necessarily challenging to train your staff on. The summers in Texas are very hot, and so some of the other treatments that we had didn't allow patients to do the treatments because of the heat and the problems with UV and heat on the skin. And we didn't have that issue with this device at all. We had amazing summer, and we did a lot of Sofwave treatments. And patients' skin typically responds very well to Sofwave, and it's uniform, it's repeatable. Patients like the treatment, and it's fairly comfortable, which is really nice to see when it comes to all the different options. And it's also something you can delegate. And I would say it's a very safe treatment, and it's good that we've been able to report the different issues that have happened in the studies. But in general, there's no epidermal damage, there's no potential injury to nerves, bones, and deeper tissues. So I appreciate everyone tuning in, and I think Carolyn's going to have some questions for us now.
A lot of good information. We only have a couple of questions, so if anyone else has a question, please jump in and write those down for us. The first one: is there anything on the market that lifts the way Sofwave does? And if so, how would that compare with Sofwave?
It's a great question. When I, as an eyelid and facial surgeon, I think lifting the brows is extremely challenging. And I think that I've not found a laser technology that does any lifting. Radio frequency technology does a great job with texture and tightening, but that's approved for lifting. I haven't seen anything. There are some minimally invasive things that are very temporary in nature and have some potential complications, such as certain threads or certain, some people think that you can lift the brow with filler, but I just haven't seen repeatable, like very consistent results with those things. And so I just have opted not to advertise that or go down that route. So I think if you're looking at lifting the brow, I basically think you're down to a couple things. And I think Sofwave is one of them outside of surgery.
What about for men? Have you done a lot for men?
We have, and particularly because if men are worried about the beard area and other areas, and they just don't want any signs of anything done, I think this is a great option. We have patients who really are worried about scars that are visible if they want to do facelifting, and also patients who are men that just do not want filler, or they do not want visible signs of recovery after laser treatments. And this is a great option for them to improve the appearance of the textures and wrinkles on the necklines as well as the facial lines. And men's brows are just heavy, so it's nice to have something. Even my patients who've had brow or eyelid surgery, they use this as a maintenance treatment. So I think it's a great option for men.
What strength topical is needed?
There are so many options these days. I think, I'd be wrong to even say which is the right one because there's so many options, but typical standard is like 23 and 7 mix is a very popular one, but I think you just have to learn your patient population. And actually, I'm not as concerned about what your compounding pharmacy puts together, but as long it's more time on the skin. And I think, I don't think you should do this treatment if you just do it for 20 or 30 minutes. I think it should be on for a minimum of 45 minutes prior to treatment. And then they're still going to feel like almost a little bit more intense than laser hair removal. And I think it's going to be awesome whenever they at least know something's being done.
Mhm.
But I think it's about time. So even if you can get to leave the topical numbing on for about an hour, which definitely, if you're an owner of a practice, you understand there's ways to do that. Some patient, it depends on what the standards are in your community. But I think you can have, if you can have topical on for about 45 to 60 minutes prior to treatment, you can have a very successful case.
Okay, we have a lot of questions, so we'll get through these as quick as I can. When will you see the maximum result, and how often should we follow up with cases?
Good question. We started doing cases, I guess, almost a year ago, and we see patients back. Usually we do a virtual or an in-person call within 3 to 4 weeks, which is when they start to see some results. Some patients walk out of the treatment, say they feel like they're already tighter. And then we've been taking a lot of photos. So we try to see patients at 3 and 6 months, which is obviously hard to do to get them to come in that much. We don't get a lot of phone calls about this treatment, but we get a lot of people asking about getting it done again, which is awesome. And so that tells you patients are happy. And I think as long as you have a good discussion and they're prepared about the fact that their recovery is going to be fairly straightforward, they're not going to have, they basically have no skincare or restrictions afterwards that they have to be on, they're kind of happy. And I like that. And so it's been very non-intrusive into our practice flow.
Okay, what about the maximum number of treatments, and what are the protocols for maintenance treatments?
So typically when we tell patients they're going to have a Sofwave treatment, we say once a year, and we are willing to retreat as early. And this is debatable because everyone's different, but some patients just want to see results quicker, or they don't lift as much as they necessarily think. And if surgery is not on the table, we just kind of maximize that. And we will say as soon as 2 months for a follow-up treatment, although I still think the technology works even as late as 3 months and continues to work up to 10 months. But some patients are impatient, but it is safe to treat as soon as 6 weeks to 8 weeks, I think, after your treatment. We've had no problems doing that. I haven't been doing it long enough to know if it's better if we did that, but I certainly think it's safe, and that's important to know.
All right, this one's right up your alley. Have you combined Sofwave with FaceTite? And, if they have a significant amount of submental fat, have you combined those two together or use lipo in
Yeah,
combination with Sofwave?
all the time, because we have patients who can't do so people aren't aware. So FaceTite is basically anywhere from 5 millimeters down to 2 centimeters below the skin. So you're treating a totally different area than you are with Sofwave. Sofwave really focuses on the surface. The FaceTite technology does treat on top of the skin as well, but I think it's a nice option for patients who have the really fine lines and wrinkles that want some adjustments and tweaking. And it can get to kind of the finer areas. So FaceTite really focuses in on just the jawline and basically the submental area and the jawline.
Mhm.
But I need to do something for the full face at the same time. So if they're not having laser resurfacing or radiofrequency microneedling, and let's say they're Fitzpatrick, 5 or 6, and certainly I'm doing Sofwave, and we consistently do combination treatment externally and underneath the skin with Sofwave as one of our options for the surface treatment, and that can be in conjunction with liposuction and treatments such as FaceTite, certainly. And I think it's a great option for patients who again don't want the appearance of something done to their skin after that treatment.
There's a lot of questions about what you can combine this with. What about, is it safe with PDO threads?
I've done threads in the past. So I can't really answer the question on that one. I think the big question is, and I think I would assume most of Sofwave brass or the team would agree, and the experts who studied it, is anytime you combine treatments on the same day, your tissue's put through the ringer per se. So you just want to kind of stick with one at a time and see which one's actually doing the job. I do understand from a practical standpoint that that patients want one downtime or they want one procedure time because they don't have the time to come in and do multiple treatments. What's really nice about Sofwave is your patients can come at any time and get it done and walk out and be on their way. You don't have to combine it with something else. And so I think it's a nice thing to combine with your less invasive things such as toxin around the same time as filler. Those are great treatments, particularly with patients trying to look more snatched or more tight and less overfilled. I think it's a great option to combine with that type of treatment. And you can see the histology. It improves the skin, and a lot of those patients are really much older patients that really would have needed a facelift plus volume augmentation plus laser resurfacing, and you're getting good results that are noticeable. And I think you just can't mistake that patients are just happy with it. We aren't getting patients who are like, oh, I didn't like that treatment. That's important to note.
Right. What about the average pulses for a full face?
That's a good question. It depends, and we divide them into 3 areas. So typically, at our practice, we have patients who come to our med spa called the Skin Gym, and basically you can choose forehead from underneath the eyes down to the jawline, everything below. So typically in the upper face, it's between 60 to 80 pulses. In the middle face, between 100 and 120. And in the neck, it can be anywhere between 70 and 100. But it really depends on how big this person is, how much tissue they have, how much laxity they have. I do think you want to try to have people who are at some that are at least, I would say, within 10% of their ideal weight, because if they're really, really full, you're not going to see much. And so you may want to consider talking to them about like a comprehensive plan on how to get there. But even those patients are going to have some meaningful results.
And what about passes? How many passes do you do? And at what level do most of the patients tolerate?
Oh man, that is variable per patient. I would recommend, if you haven't demoed the treatment, I think you need to go through it and see what the tolerability is, because of course you want to crank it up as high as possible. But I just think, and I've trained for I've trained for other companies. I've worked with other devices. I think you should go to the simplest, most low settings possible when you're starting to get your training down and see what you can do, and then work your way up. One thing patients want and providers want is to do a lot, do it quick and do it hot. And I just don't believe in that. I think you need to just go slow and get comfortable with technique. And then from my mother to my wife, to everyone who's gotten this treatment done, everybody's pain tolerance is different at different levels. And so I think you just have to listen to your patient. If your patient's feeling it, listen to them and stop the treatment. Like or at least turn it down a little bit. Like patients' bodies are completely different. So I think you have to really do some treatments to understand.
The arm picture that we saw that's off label and the abdomen area, someone wants to know the parameters of that. Have you treated anybody off label with arms or abdomens?
Yeah, so my specialty is eyelids and face, but our practice has body plastic surgeons in it as well, and we've explored those things because it's safe technology. I know there's potentially a lot of research coming down the pipeline in the future, and so we're just kind of waiting to see what those look like. But I think it's exciting to have something again that doesn't have a visible sign of treatment. But with the body, again, you need a full analysis of it's really for face and body. It's all about the expectations of the patient and understanding what they're trying to accomplish. Because if a patient's expecting a surgical lift or surgical tightening and they don't get that, and you haven't told them that's not going to happen, or that may be not possible without surgery, I think they'll be disappointed. But there's some patients who've done everything possible that just have some areas that they just want tightened. And I think that, things that are visible, particularly like in the summer months or when you're at home with your loved one, arms and body, it's really personal. You want to do something that's going to have results, but also that you feel good about as a provider that's going to provide results, because you don't want to treat someone and not see anything either. You feel bad about it as a doc. What
about post Kybella? How long would you wait to treat someone with Sofwave?
I've seen kind of this downtrend in that treatment in particular, but Kybella, and I'm not using it as much anymore, but I think
would you need Kybella with Sofwave?
So a couple things to note. So Kybella's indication was to break apart, it's the oxycholic acid. It was meant to break apart the fat cells in the submental area. The issue with Kybella that a lot of us face, it was very uncontrolled. There was lumps left behind. So the goal was really to treat fat specifically. Sofwave's indications has nothing to do with fat at all. It doesn't treat that deeply, but what it does is it does lift up the tissue in the submentum. So I think that from a combination standpoint, if you're doing liposuction, or if Kybella is your choice for fat, you have a choice for fat. And then if you want to do something for laxity in the skin, you can do a neck lift. You could do other technologies, or you could do Sofwave as well as an option for lifting of the skin. But I think they're kind of complementary treatments. I've not done the combination of those together, but I could see how they could be complement treatments.
Is there any downside of increasing the number of pulses? Am I risking more side effects if you do more pulses?
Yeah, I mean, I think with anything, like I mentioned earlier, if your inclination is to use more pulses and go off label from what the company recommends, I think you're risking a thermal tissue injury. Although this is extremely safe, you really don't need to do that. I think the only time you'd want to do additional pulses if you had a person who just had a larger facial tissue structure and you'd want to cover more ground.
Everyone, thank you for being with us, and especially you, Dr. Paul. Thank you for going through the slides. It was a great presentation. We really appreciate you. And we'll see everybody on the next webinar or the next event. So have a good night, everyone.